Hello, I'm Dr. Ira Nash. Welcome to Well Said. For years, many expecting mothers were told to take it easy and avoid too much physical activity during pregnancy. But today, we know that exercise, done safely, can be one of the best things for both mom and baby. From improving energy and sleep to reducing complications like gestational diabetes, staying active can play a big role in a healthy pregnancy. Still, plenty of questions remain about what's safe, what's not, and how to find the right balance. To help us sort fact from fiction, I'm joined today by Dr. Kara Pessel. Dr. Pessel is the director of the cardio-obstetrics program at Northwell Health. She's also an associate professor at the Zucker School of Medicine at Hofstra, Northwell, and the director of Maternal Fetal Medicine fellowship program at Northwell Health. Kara, welcome to Well Said.
Thank you so much for having me.
Among your titles is the Director of Cardio-Obstetrics. What is cardio-obstetrics?
I'm glad you asked. So cardio-obstetrics is this evolving collaboration that has emerged over the past couple of years between cardiologists and obstetricians. Why these two fields? Well, number one, we recognize that cardiovascular disease is unfortunately one of our leading causes of death in women in our country. Pregnancy, as we'll focus on today, is really a stress test in a way. There's a lot of extra work that goes into pregnancy, and it can unmask or exacerbate existing heart disease. So it takes a village. It takes an obstetrician, a maternal fetal medicine doctor, and a cardiologist to help take care of these patients with heart disease.
Yeah, it's an interesting kind of sign of the times as medicine has gotten more sophisticated. As our capabilities have expanded, our specializations have narrowed in some ways.
Exactly, and we have to lean on each other a little bit more. So together with Dr. Evelina Graver of cardiology, we help with the multidisciplinary management of people who have heart disease who want to grow their families.
Yeah, that sounds great. So we're going to be talking mostly about exercise during pregnancy. But before we get into that, I want to have you review the normal impact that pregnancy has on a woman's body. As you were saying, it's kind of a stress test. And I can tell you as a cardiologist, I've always perhaps simplistically looked at pregnancy as kind of analogous to prolonged exercise. So what is the physiologic impact of a normal pregnancy itself?
Great question. And it's not simplistic. I think you're on the right track there. So pregnancy is an exciting time, of course. It's also a time of major change for your body. So big picture, your heart has to pump more blood, more volume to more places. So starting in the very first trimester, you may not even know you're pregnant yet. Your heart is already beating faster, squeezing harder, and remodeling itself to be able to deliver your increased blood volume, your increased, water that you're holding on to not only your growing body, but your uterus, the placenta, and the fetus. So over the course of the pregnancy, hopefully 9 months, we get a significant increase in heart rate, in cardiac output. Your heart starts out the pregnancy pumping about 5 liters of blood a minute. And by the end of pregnancy, by delivery time, it's about 7 liters. So it's almost a 50% increase.
So that is like exercise.
Yeah. Even when you're sitting on the couch, you are exercising. Your body's doing a lot of work.
Right. Say a little bit more about the normal adaptation to that increased demand. What is actually happening with the heart, with the cardiovascular system during pregnancy? Because I think that's going to blend nicely into our discussion of exercise.
Yeah, absolutely. So the heart really does the bulk of the changing. So you get this temporary remodeling of the heart muscle. It has to kind of bulk up like you would, like an actor would for a role. I have to put on muscles. So your heart is going to actually remodel itself, grow a little bit bigger. It's going to beat a little bit faster. So the heart rate goes up throughout the course of the pregnancy. Can be normal for a pregnant woman to have heart rate in the 90s, even low hundreds, just to keep up with the demand of the body.
And just as a reference, we generally say normal heart rate is above 60, but below 100.
Exactly. So a little bit faster can be normal. It's your body's way of compensating, of adapting, of keeping up with the demands of the pregnancy. At the same time, the blood vessels throughout your whole body, they do relax for first half to 2/3 of the pregnancy. They're trying to help out the heart. They're trying to make the heart's job a little bit easier by putting up less resistance. So the blood pressure tends to drop.
So making it easier for the heart to deliver all that blood to the uterus and everywhere else.
Exactly. Okay. So by dropping that resistance that your heart has to push against, that drop in blood pressure is going to be helpful for your heart to get the job done.
With that as this sort of backdrop or context. What happens when a woman engages in what we would typically think of as exercise while she's pregnant?
So you start out kind of coming in at this working harder than you would at baseline when you're not pregnant. So you can actually achieve your maximal heart rate, an effective level of exercise with less effort when you're pregnant, which is helpful. I think, I'm glad we're here today talking about this. I think taking some of the myths out of exercise in pregnancy is important, and it's really strongly encouraged for pretty much all pregnant women, with few exceptions, to exercise regularly.
And why is that? What's good about exercise in pregnancy?
Exercise is one of the essential elements of a healthy lifestyle for everybody, not just pregnant people. It helps to improve your heart health, your respiratory health, keep you at a healthy weight, help with blood pressure, all the things that go into a healthy cardiovascular system.
Can I stop you there for 1 second?
Yes.
So I can imagine somebody listening to us and saying, yeah, but if I stop for the 9 months when I'm pregnant, how big a deal is that?
So specifically in pregnancy, exercise is one of our tools, one of our things that we can recommend that help improve pregnancy outcomes.
Okay.
So things like gestational diabetes or excessive weight gain, things like preeclampsia or hypertensive disorders of pregnancy, they are decreased among women who exercise almost every day. We can reduce the risk of C-section. We can reduce prematurity. All these specific pregnancy outcomes are improved when we exercise regularly.
And what's the connection there between lower C-section rates and being more active during pregnancy?
It's probably a couple-fold. So number one, if exercise is reducing gestational diabetes, then it's helping to keep babies from kind of overgrowing. In the setting of gestational diabetes, babies can grow maybe bigger than they were destined to be, and that can be one piece of why more people who are inactive may need C-sections. Another major piece of it is going to be the condition that you're in when it comes time for labor. So the more you're exercising, the more strength you have in your abdomen, in your back muscles,
So
the more
less
endurance.
likely to just tire out and require a C-section to get the baby out.
Yeah, you have that, if you're doing yoga, Pilates, you have that flexibility, you have the strength, you have the focus, the breathing. All of it can make for a more effective labor and effective pushing.
You and I have both used the term gestational diabetes. I think we should define that.
All pregnant people, unless you already come into pregnancy with diabetes, everybody gets screened for something called gestational diabetes. So the placenta in and of itself will produce these steroids, and they're essential for the pregnancy, but they can also push someone who maybe has a family history of diabetes, maybe 10, 20 years down the road would be destined to develop diabetes, and the presence of this placenta and its actions can kind of accelerate that process, push them over that edge. And now all of a sudden in pregnancy, this otherwise healthy person is now having trouble keeping their sugars in a normal range. They're eating foods they used to eat, but their sugar is spiking. And so that we screen everybody for, because it can be dangerous for moms and babies, and it can require some modifications to diet, exercise, and sometimes medication.
Right. The major danger of having elevated blood sugar during pregnancy, you mentioned one, that there's sort of an accelerated growth of the fetus. What are some of the other challenges?
Highest risk scenario when diabetes is really poorly controlled, we get babies that are gaining weight much faster than they should. They can actually outgrow their placenta, their fuel source, and that's unfortunately when we can get things like stillbirths. In a less extreme example, when you have a much larger baby, you can have things like birth trauma, needing a section, having severe maternal tears that need to be repaired at delivery, and then neonatal adjustments. So babies who were exposed to very high sugars in utero, as they deliver, their sugar is going to drop. They can need some short-term extra care from the NICU doctors.
Okay. Sounds like exercise is a good thing.
Yes.
There's probably concerns about just how safe it is. What's kind of good exercise and what's not such good exercise?
Almost all pregnant women, if you're home, if you're able to be at home, you're not hospitalized for a pregnancy complication, almost all pregnant women can safely exercise, within some parameters. So what do we want to avoid?
Yeah, let's talk about the parameters.
Yeah, so number one, we don't want you to fall. So we want to avoid balancing acts, skiing, surfing, horseback riding, even riding your bike out on the streets. Those things are discouraged, especially as we get out of the first trimester past 14 weeks. I say that because in the first trimester, the uterus yes, it's growing, but it's still small enough that it fits in that bony pelvis. It's kind of protected by that bony cage. So if you fall, it's not good, but the uterus should be pretty shielded. Once you get out of that first trimester, falling, hitting your abdomen can be a lot more significant.
And I imagine that women who in later stages of pregnancy are also have a different center of gravity, and so their balance may not be what they think it is.
Not even the later stages. That center of gravity changes basically day to day. You can still be pretty early and your center of gravity is changing. Your joints are changing. Everything deliberately is becoming more lax, stretching to eventually accommodate a baby. Plus, you are gaining weight. You're supposed to be gaining weight. So even experienced yoga enthusiasts or Pilates enthusiasts might want to take it back a notch, have a chair nearby, a wall nearby, something that they can use to steady themselves because they might feel a little bit different in their own body.
Okay, so avoiding things where you might fall, literally. Yes. Other things that we want to avoid before we get to some things that are good things?
So you also, when you're pregnant, your metabolism is increased, your basal temperature is increased. So we want you to avoid really severes of temperatures or extremes of temperatures. So like Bikram yoga, I wouldn't pursue when you're pregnant.
No hot yoga.
Sorry, no hot yoga. You'll be sweaty enough. You want to avoid extremes of temperature. You want to make sure you're hydrating before you exercise, while you're exercising, after exercise. Your body needs so much liquid in pregnancy. It's almost insatiable. So just keep hydrating. And then what else to avoid? You want to avoid contact sports. Again, especially after the first trimester, you don't really want to be engaging in like soccer, ice hockey, things where you can get hit, especially in the abdomen or anywhere in your body where then you could fall.
I'm thinking of some other sports, running, tennis. What's your feeling about those sorts of things? Running,
yes. Tennis, yes. So what we want to encourage is ideally daily aerobic exercise, moderate intensity for 150 minutes a week. So I said daily, you could maybe make it like a job, Monday to Friday, 30 minutes a day, or you could spread it out to include the weekends. Now, what do I mean moderate? Moderate means you are working a little harder than you are in your day-to-day. Your heart rate's up a little bit above its baseline. Maybe you're sweating a little bit, but you are able to have a conversation. You're able to talk. Maybe you're not able to sing, belt out a song. That would be tricky, but you should be able to keep up with your breathing, keep up with a conversation. Now, if you're coming into pregnancy and you do much more than that, let's say you are a distance runner or you're a tennis player, you can absolutely keep that up. I would, at your first prenatal visit, run that by your doctor, explain what you do. But most, even elite athletes, people who train very hard, if that's what their body's used to and they become pregnant, they can usually keep that up.
Can I ask you a specific question? You mentioned long distance runners. I understand what you're saying about the sort of cardiovascular capacity that those people have before they become pregnant. But what about the sort of bouncing up and down that inevitably occurs when you're running? Is that a problem?
I see what you mean, that movement seems a little disruptive to a growing baby and a placenta. The uterus is actually so insulated and it is so grounded. It's attached, in several places. So you running, power walking, jogging, that movement is not going to disturb the baby or the growing pregnancy. If it's uncomfortable, there are things like belly support band. Make sure you have a sports bra that fits well, sneakers that fit well. Your feet, they might grow, they might be swollen in pregnancy. So you might want to grab a new pair of sneakers that are maybe half size up. So there are things you can do to modify and make sure that you're comfortable. If jogging feels good, it's not a problem. It's not inherently dangerous. At the same time, if you're feeling uncomfortable, if you're feeling pain, I don't like this sensation of my belly or whatever it is in your body that's hurting you, listen to your body. You don't want to force it. Dr. Pessel told me on this podcast I should be running. I'm going to run. You have to listen to your body. If something's hurting, if something new that you haven't felt before is happening, bring that to your doctor and take a break until you run it by them.
Yeah, and I imagine that you come across many women who are physically active before they become pregnant, and it feels bad to stop. Right?
Absolutely. Exercise, we talked about some of the pregnancy benefits. There is, moving is good for you. It's good for your mental health. It's good for your muscles to move. It's good for your conditioning. It can be good for pregnancy ailments like constipation, like low back pain. My main message today is you don't have to stop exercising, doing what you like to do, Pilates, yoga, stationary cycling. You don't have to stop that just because you're pregnant. And in fact, we encourage you to really continue it.
Yeah. So what about women who are not particularly active before they become pregnant? Do you counsel them to start an exercise program during their pregnancy?
Yeah, absolutely. So sometimes I meet people preconception, and I think that's probably the best time to start getting more active, start working in these activities, these 150 minutes a week of moderate aerobic activities. But if you're pregnant and you haven't done anything, that's okay. Some things to keep in mind is you don't want to go 0 to 60. So if you're just starting, you want to take it slow. Maybe start 5 minutes walking a day, and then every week tack on 5 more minutes, 5 more minutes. You want to stretch before you start a new activity. I would recommend a quick cool down afterwards, maybe stretch a little bit afterwards, just so you're not shocking your muscles and doing anything too abruptly.
Could you say a little bit more about how the recommendations that you provide kind of evolve over the course of an uncomplicated pregnancy?
Most of these exercises you can continue from day one up until delivery, and then, hopefully get back on your feet pretty quickly postpartum. The 150 minutes per week of aerobic activity, which again can be walking, jogging, cycling, tennis playing, that's from day one to delivery. The only modification I would make, especially if you're someone who likes Pilates and yoga, is the second half of the pregnancy, 20 weeks and beyond. We really don't want you laying flat for any prolonged period of time. And that's just because by that time of the pregnancy, the uterus is so large, filled with baby, placenta, fluid, that it's up to about your belly button, and it's only going to get higher. So if you lay flat, that uterus is going to compress on some of your major blood vessels, and that can impair your blood from getting from your feet and your legs back to the heart and oxygenated and back out to your body where your muscles need that oxygen and that blood. So we don't want you laying flat for any extended period after 20 weeks.
Okay. But that sounds like general advice for people who are pregnant. It's not related to exercise per se.
Exactly. Just, some yoga, there's moves where you're laying flat,
Okay.
What's it called?
Don't ask me.
I forget. Dead bug. The dead bug.
We've been talking a lot about the mom.
Mm-hmm.
You want to say anything about the impact of exercise on the developing child?
So again, some of those pregnancy benefits extend directly to babies. So by lowering gestational diabetes, preeclampsia, we can improve fetal growth, circulation to the placenta and to the baby, and we can optimize outcomes that way. Over the years, there have been concerns, if mom is working out and her blood is going preferentially to her muscles, is that coming at the expense of the baby and the placenta? And it was kind of a line of thinking of take it easy so that the baby can get everything. Multiple studies have been done that really hasn't panned out in terms of objective data, fetal heart rate, something called non-stress test where we monitor the baby's heart rate right before, right after, and even sometimes during pregnancy. Babies can compensate. The blood flow between mom, placenta, and baby is so sophisticated and reactive that they can compensate, and there's really no negative effects of these exercises on the baby.
Yeah, I want to go there a little bit. You were talking before about counseling women to basically not do things that are uncomfortable. Mm-hmm. Are there any more sort of concrete guidelines that you offer your patients? Because I can imagine some women feeling a little uncertain about whether what they're doing is really a good idea or not. They don't feel that bad, but maybe they're a little concerned. So what do you tell those folks?
Take it step by step. So if you're someone who came in very active, running marathons, and you feel that either, number one, you're not up to that, maybe first trimester, you're nauseous, you're achy, for whatever reason, you don't feel up to it, it's okay to take it down a notch. It's okay to, bring down your level of intensity 1 or 2 notches until you gain that confidence and you feel okay doing that. At the same time, I want to empower people to know that it is okay. It's not dangerous. It's not frowned upon. It's not discouraged to be doing these activities. Quite the opposite. We really want you getting out and being active. And when in doubt, I'd say ask your doctor, run it by your obstetrician. Hey, is there any reason I can't be doing my stationary bike or going for a walk today? And, they can answer any specific questions, specific ailments or concerns that you have.
And what about the period right after delivery? How does the activity of the mother during pregnancy impact that early postpartum period?
So the more active you've been, the more in shape your muscles are, your mood, your conditioning, your endurance, the more helpful that is in getting back on your feet. We encourage after vaginal delivery or C-section, getting up and walking definitely by the first day post-delivery. So the more you've been doing that and the more you're conditioned to do that, the easier that transition is going to be. And, postpartum is still lots and lots of work. Maybe the heart is starting to get back to normal, but now you're up at all hours of the night.
I was going to say,
walking
not to
the
mention
baby.
that you have a baby to take care of.
Exactly. So in the days of bed rest, bed rest is not really a thing anymore. It's not really recommended with very few exceptions. But in those days, someone would lay down almost all day, every day for months, and then all of a sudden have a newborn or 2 or 3 and not be able to use their body the way that they should. So the more in shape you stay or get during pregnancy, I think the easier that transition is to being a new parent.
You mentioned mood. We did a show a number of years ago on postpartum depression. There's been a lot in the lay press about that. Is there any clear connection between physical activity and sort of mitigating the impact of potential postpartum depression?
Yeah, absolutely. And, some of it may be a little bit of a chicken and egg. If you are feeling depressed, it might be harder to get out and vice versa. Certainly, whether you're depressed or having anxiety during pregnancy, after pregnancy, movement, activity, doing something is always one piece of the kind of multi-layered approach to that. So I would encourage daily activity, getting outside, go for a walk with a friend. All of these things can help, whether it's postpartum blues or postpartum depression or anxiety. It's one modifiable thing within your control for the most part that you can do to help with those symptoms and those feelings.
Yeah. Were there other things that you wanted to make sure you were able to say to our listeners that I didn't specifically ask you about?
My biggest message is to be active in pregnancy. Heart health really is a lifelong goal, and it doesn't need to take a break during pregnancy. It's a time where you can continue being active and really help to improve your long-term health, baby's long-term health. And when in doubt, ask your doctor if you're having...
You mentioned heart disease again, and I guess we should take a minute to talk about women who have significant heart disease before they get pregnant, how the pregnancy may sort of complicate the management of their heart disease and vice versa. Mm-hmm. What's your general approach in those kinds of more complicated situations?
It's important, ideally, before you get pregnant. If you have any heart disease, you had surgery as a baby, you're not even sure of the details, you had a murmur that time, you had that rhythm in college that had to be checked out, whatever it is, if you've had a heart condition in your life, you definitely want to touch base with your cardiologist and or your gynecologist before getting pregnant because of the increased demand that we talked about before. Even if you've been stable, healthy for years, pregnancy can resurface heart disease and kind of push you over that brink of going from being stable to a little bit precarious. And there can be pretty significant maternal and fetal risks of getting pregnant if you're not quite optimized, if you're on medications that are potentially dangerous in pregnancy. So it's important to touch base with your doctors. We actually here at Northwell have something called the Home Clinic. It stands for Heart and Obstetric Multidisciplinary Experts. So at one visit, patients can come see me or one of my colleagues from Maternal Fetal Medicine, and at the same time meet with a cardiologist. We get their echo that day, their EKG. We do a physical exam. We counsel them about, okay, for you with your specific condition, with how you're feeling, with what exercise you can do, this is our level of concern for pregnancy. This is what we'd recommend. This is what your surveillance is going to be like, just to make sure that people enter pregnancy as healthy as possible and stay as healthy as possible.
Yeah, well, that sounds like a great program. I want to just reiterate that you're talking about people before they get pregnant having that evaluation, right? That's the best time to do
That's the best time. We also see patients once they are pregnant as well.
Yeah.
I guess the one thing we didn't touch on is this kind of newer recognition of a link between pregnancy complications, like someone who enters pregnancy completely healthy,
right,
and over the course of their pregnancy, they get preeclampsia, or they go into labor preterm and they deliver, or the baby has fetal growth restriction. What we've found is that, we used to think, okay, you graduate at delivery. You had preeclampsia, but now you graduate.
Right, now you're done.
You delivered your baby. Cross this off your list. You're done with this. Now we realize that these pregnancy complications are almost like foreshadowing. It's like glimpsing into the future. Just having had that complication does unfortunately put you at risk of heart disease in the future, the same as like smoking cigarettes would or high cholesterol would. But the good news is 80% of heart disease is preventable if we can spot it early, make changes to our diet and our lifestyle to help prevent that progression. So, if you've been through preeclampsia, if you've had a spontaneous preterm birth, you had fetal growth restriction, that shouldn't stay in your obstetrician's office. You should tell every doctor you ever see about that.
No, I'm really glad you brought that up. As a cardiologist, I've learned to take a better obstetrical history.
Excellent.
Right? Because of exactly what you say, that it matters that a woman had high blood pressure during her pregnancy, marks her as somebody who's more likely to develop high blood pressure later in life than she would have otherwise.
Absolutely. If you compare a 45-year-old person who never had a pregnancy complication with a 25-year-old person who had preeclampsia in their pregnancy, it's the 25-year-old at a higher risk of hypertension over these next 10 years. So it can really change your risk profile, what goes into what you should be doing. Should I take aspirin? Should I take a statin? I defer that to the cardiologist, but it's definitely something you should continue to bring up at your doctor visits.
Yeah. So last question, if we've stimulated interest in our listeners and they want to get more information about the topic we've been discussing, where would you recommend that they find high quality information about this?
ACOG, the American College of Obstetrics and Gynecologists, has a lot of patient-facing materials. So if you search ACOG, or even if you search pregnancy, exercise, OB-GYN, it should bring you to a site like that. You can also check out our Northwell website. We have the Northwell Cardio Obstetrics program, and you can find lots of great links, articles on this and similar topics.
Well, great. Thank you so much for joining us.
Thank you so much for having me.
My guest today is being Dr. Kara Pessel. She is the director of the Northwell Cardio Obstetrics program, the director of the Maternal Fetal Medicine Fellowship program at Northwell Health, and an associate professor at the Zucker School of Medicine. Thanks also to our producer, Lois Bentavenia, and our editor, Ed Lee. For more information about this program and to find all of our past episodes, please visit our website at medicine.hofstra.edu/wellsaid. You can also subscribe to our free podcast wherever you get your podcasts. Our listeners are welcome to send their comments, suggestions, and questions to wellsaid@hofstra.edu. Until next time, I'm Dr. Ira Nash, and that's Well Said.